Hello. I've started IVF a while ago, and I'll tell you something very important for the whole procedure. Stay positive and keep smiling. The doctor has prescribed CETROTIDE for me as well. Let me show you how it's done. You'll see, it's not difficult at all. CETROTIDE inhibits ovulation until the follicles mature. It is available in 2 types, including either 1 or 7 kits. In each box you will find a vial of powder, a ready pre-filled syringe with the solvent, a needle with a yellow mark to be used for the preparation of a solution, a needle with a grey mark suitable for subcutaneous use, and 2 alcohol wipes. Once you purchase the CETROTIDE injections, store them in the fridge. CETROTIDE should be injected daily at a regular time. Choose a fixed time in the afternoon between 5 PM and 8 PM. You can inject at the same time with the ovarian stimulation injection on the other side of your belly, unless your doctor tells you otherwise. You should always follow your doctor's instructions. Firstly, we wash our hands very well with soap and water. One last check that we have everything in hand, and off we go. Remove the cap from the powder vial. Unscrew the protective cap from the pre-filled syringe. Unscrew the protective cap from the needle with the yellow marking, and screw it onto the pre-filled syringe. Next step, push the yellow needle in the center of the rubber stopper. Now inject the liquid into the vial by slowly squeezing the plunger on the syringe. Without removing the needle, mix with gentle rotating motions until the solution is clear and free of particles. Don't shake vividly to avoid creating air bubbles in the solution. Turn the vial over and draw the liquid out, slowly and carefully by pulling the syringe plunger. For easier suction, lower the tip of a needle into the gap in the inner side of the rubber stopper. Be sure to draw liquid and remove the needle from the vial. Carefully put the protective cap back on the needle and unscrew it. Throw it in a special bin. Now unscrew the protective cap from the needle with the grey marking and screw it onto the pre-filled syringe. Remove the needle cap and hold the syringe with the needle facing upwards. Tap lightly to help any air bubbles rise to the top. We don't want any air bubbles in our solution. Then gently push the plunger for any bubbles to come out. If you need to place the syringe down, make sure you put the protective cap back on first. And now we are ready to inject. It's not as difficult as it seems. The injections are made in the abdominal area, in the small below the navel, 2 to 3 fingers right, left or down, at a different spot each time. Pick the spot and clean the area with the alcohol wipe. Lift the skin in the area and insert the needle with a steady and firm motion, vertically or diagonally. Don't worry, it's very thin. Now push the plunger gently and continuously, without stopping, until it stops coming down. When the syringe is completely empty, remove the needle. That's it. Gently press on the injected spot and massage lightly for 2 seconds. Close the needle with the protective cap you have held aside. Used syringes should be disposed of in a special bio-waste bin. If you do not have access to one, keep them and ask Embryolab to be discarded safely through their bio-waste management system. It is only normal to feel a slight irritation and maybe a bit of itching at the spot you just injected immediately after using CETROTIDE. Don't worry, after a while it recedes. See, it wasn't that hard. Here, you can find some more useful tips. For any additional questions, you can always contact Embryolab.